What's up, everybody? It's Porter, just making a new video just to keep you all posted on where I am with my health and everything going on in my life and stuff. Because, if you've been keeping up with me, I got kind of a lot going on with my health. And so I'm just going to update you like I do right now. At this moment, I'd say my level of pain is like, out of 1 to 10 is like a 4. I shared that in the past, in some of my past videos. Ever since I got out of the hospital in September, my level of pain every day hasn't really ever gone down below a 4, but in September it was like a 10. So I'm doing better. Still some pain involved. Inside of my mouth is still real torn up. Still not eating food. Still got my feeding tube. Nosebleeds are still happening. Very random nosebleeds. Bleeding in my mouth is still happening. My tongue is extremely beat up. It's real bad. Just being honest and just being upfront about it. I know I told you all about the IVIG infusions and stuff, and how those are really supposed to help me start to see like more serious and promising signs of improvement and like getting closer to my state of remission that I want to get this disease into. Next week, Monday, Tuesday, and Wednesday, I'm going to be getting another 3 rounds of IVIG infusion, home infusions at my house. It's going to take 6 to 8 hours at a time, just like it always does. And I think this is going to start to be, as far as I know right now, my doctors have told me that this is going to start to be like a monthly thing. I'm going to get 3 rounds of IVIG once a month. But some other new news with all this going on, I've known this for a few weeks now, but I haven't really shared it yet, just because like I don't really want to give anybody the wrong idea. I've told you all about how like I really don't do this for sympathy and stuff, and like I kind of always touch back on that because like I really don't. I don't care about that. I'm doing this for tracking my progress. I've told you all about that. But anyways, 2 weeks after my next IVIG infusion treatment, which is next week, 14 days will pass after my last infusion. So I'll get my last infusion next Wednesday. 2 weeks will pass. I'll go to Chapel Hill. I'll go to the hospital. And there I'm going to start this new treatment. Haven't done this yet, but it's called rituximab, and it's a type of chemotherapy. They do use it on some cancer patients. I'm not sure what type of cancer, but it is like a cancer protocol. So the risk is higher and stuff, but it isn't. The doctors have let me know it isn't the type of chemotherapy where I'm gonna lose my hair and stuff. The risk is higher as far as my immune system will be destabilized. It'll be really, pretty easy for me to get sick. So I'm gonna have to be really up on my hygiene, always washing my hands, just real careful. I can't really be around anybody that's any type of sick at all, because my immune system is really gonna be compromised whenever I start this chemotherapy. So that's new news for you all. I've known about it for a little while now. I just wanted to keep it 1,000. Just be honest with you guys. I'm not really worried. I know it's not like good news. Chemotherapy doesn't sound like good news, but I'm kind of looking at it. I'm trying to look at it as good news because I'm about to get my 3rd round of IVIG. And what my doctors have told me is that this is an extremely rare disease called pemphigus vulgaris, which is what I have. And they say it not only is it rare, it's even more rare for someone my age to get it at all. So like people that do have this disease, my doctors have told me they're usually a lot older, 40s, 50s, 60s area, like just much older than I am. I'm 20. But they said that most people with this disease who get IVIG they react to it, and also who are on immunosuppressants and steroids, which I'm on both. I've been on both for months now, and my mouth is still, I'm still very symptomatic. I still am not eating food and stuff, so I'm trying to get past that. Like I'm trying to fully heal, get this disease into a state of remission, get this feeding tube out. You all know where I want to be, or at least the people that actually do know me. But my doctors have told me that I have this severely, and they've let me know that most people who do have this disease, who are on immunosuppressants, like I've been for months, like I said, and get IVIG, my doctors basically told me 90% of the people who do those things with this disease respond and react very positively, very quickly, and they start to heal and they go into that state of remission. And months have gone by for me, and that just hasn't happened for me. So basically, my doctors are telling me, out of that small circle of people that do have this disease, I'm in an even smaller circle of just a level of severity, I guess I would say, or whatever. So out of the even smaller group that I'm in, there's been a study on this rituximab chemotherapy treatment with people that do have pemphigus vulgaris who don't respond while taking immunosuppressants and steroids and also get the IVIG. Doctors' studies have shown, alright, so people with pemphigus vulgaris who don't respond to those things, they give them this rituximab, this chemo, and they respond really, really well. So this is like good news, and I feel like it's good news because like I haven't really responded to the medicine that I take every day. I literally take like 6 or 7 different pills every morning and a pill at night every single day. And those things are, these steroids and this Imuran, immunosuppressant like medicine, is supposed to like help me, but not saying it isn't helping me, but it just, I haven't really seen serious signs of improvement or anything yet. So this rituximab is the next step. So I'm looking at it as good news because I feel like, I'll get my IVIG next week. 2 weeks will pass, and then I'll do the chemo, and then I feel like, maybe this is the push that I've been like waiting for. Maybe this is the key. Like maybe this is what I need. And so I'm not scared. I know I'm not gonna die. Like I know I'm just looking at it as good news. Like that's how I'm trying to look at it. It will also be through an IV. It doesn't take as long as the IVIG. My doctors told me that the rituximab takes like 3 hours or something. So that's not so bad. But something else going on with me. I started school this week for my welding certification. So I feel like by the time I'm 21, which will be April 2nd, I feel like I'll have my welding certification. Like I'll be certified because I have some experience. I'm going to school for it now 4 times a week, from 8 to 12, Monday through Thursday. Just going to school and literally just welding, practicing my craft, just trying to get it close to perfect so I can get certified. And then my goal is to be certified here real soon. And then my ultimate goal is to be healthy very soon, real soon. And by the time I'm back on 100% back on with my 100% health and this disease into a state of remission, I'll have my welding certification and I'll go back to my old job, and I'll probably be starting off somewhere like $13 an hour, which that sounds good to me. So that's like my ultimate goal. That's what I'm shooting for. But right now, I'm just kind of taking it easy, not working. I want to be working, but I have so much going on with my schedule. I just got in school, and then I have this IVIG coming up next week, and the doctors have told me it's going to be like once a month from now on, I think. So like once a month I'm going to get IVIG for 3 days, I'm pretty sure. So yeah, I just got a lot going on with my schedule right now, and my doctors also tell me, you don't need to be overworking yourself, because watching my weight and whatnot with a feeding tube and everything. So I do want to work. It's kind of frustrating just waking up every day, not being able to make money for yourself, but that's why I'm glad I'm in school right now, because it keeps my mind occupied. That's why I'm glad I started school. It gives me something to do, something positive. And yeah, so I'm doing pretty good. I'm hanging in there. I'm trying my hardest anyways. Some days are harder than others. I said that in my last video, but it's the truth. I try and stay as positive as I can. Sometimes it's just hard, but I know I'm all right. I'll get there. Just one day at a time. I'm really grateful for the people in my life and the support system that I have, my family and my friends. And because, without those things, I feel like I'd have gone crazy a long time ago. So, thank you all. You know who you are. I say it every video, but it's because I mean it. This is tough. But it's not tougher than I am. I'm going to stick it out. I'll get there. So I'll keep you all posted. Until next time. Peace out.